Hi everybody! For this week's discussion board posting, we're asked to discuss two different topics. One, the life course model, and then also the application of a feminist perspective to the provision of care. I think these are really interesting topics. So the first question is, why is it important to consider a woman in the context of her life when you're providing care to her? And my thought on this is that factors in her whole life can affect her health. In the article by Dr. Mishra, Dr. Cooper, and Dr. Q, they describe that early childhood, and even intrauterine events can affect long-term and specifically reproductive health outcomes. So if we only look at the patient as she is right now, say sitting in the office, all we see is a snapshot of her. We might be missing important factors that we might consider in order to give her better guidance or offer her better overall care. Dr. Liu, in his article, shows us how a more interdisciplinary approach or holistic approach can improve care, specifically preventive care, and even overall health promotion. And in that article, they describe that in the setting of a medical home, which midwives are very able to provide, the example they give is prenatal care, you might integrate many different specialties. So the patient sees a primary care provider, say a midwife, who then incorporates specialists or, other providers, including maybe social work or nutrition or a specialist, maybe physician care like MFM or gastroenterology or whatever the patient might need. And in doing so, we both, financially cut costs, but also we are better able to see the patient in the bigger picture and still give her the care that she needs. The second question asks, how would a feminist perspective influence how you provide care? And I think the two questions asked in this module are very, very much related. A book for another course that we were asked to read sections of, Dr. Schuling and Dr. Likas, their text on women's gynecologic health. The preface and the first chapter for me were eye-opening and revolutionary. I love their description of healthcare from a feminist perspective. In fact, they describe that the historical biomedical reduction of a woman to her parts and pathology negates both her expert knowing, the woman is the expert on herself, as well as her agency. And the tenets of care from a feminist perspective that they describe include seeing yourself as serving with women as opposed to for women, or even, as happens in the biomedical model, finding things to do to women. And also, the feminist perspective rejects homogeneity, respects the individuality of patients, rejects the power imbalance that is often set up between clinician and patient. It rejects the androcentric pathologizing of womanhood, which is a wonderful way of putting words to, seeing womanhood as just like non-manness or, disease state only, when you see all of healthcare from a male perspective. And it also directly acknowledges the woman in the broader context of both her life and of the healthcare system, which kind of links to the earlier topic. The wonderful book we were asked to read, Witches, Midwives, and Nurses, really has an interesting critique of the healthcare system. They are quick to point out that this is not a critique of any individual doctor or even hospital, or, that this is a quote. They describe that sexism predates medical science, and sexism is deep-rooted and both sustains and is sustained by the male-dominated class system as it exists in healthcare. And while this text was written in 1973 originally in the first edition, and I believe that much has changed since then. There are certainly more opportunities for providers, for women as providers now, though I think there is more change to come, and as midwives and women's health nurse practitioners, I think we can be agents of that change in supporting both patient autonomy and patient individuality and tailoring our care in that way. So I look forward to hearing your thoughts on this topic. Thanks for listening.